Yes. Good afternoon, Governor. This is Andrew Armstrong in Flint, and thank you for this town hall. My question is specifically not so much who's responsible for what, but clearly there are a number of children that have been seriously injured and their futures potentially damaged, and there's talk about helping them out. I wonder what specifics you can give us about what the plans are to help these children and who's involved in implementing those plans.
Thank you, Andrew.
Yeah, Andrew, I appreciate that. Yeah, actually, there's an extensive list of programs that we're putting in place. We're working on getting in alignment there to help kids everything from prenatal through the first 10 years of their life and longer. And to actually walk through that list, I'll turn over to Nick Lyon, who's our Director for Health and Human Services.
Thank you, Governor Snyder, and thank you for the question. Certainly, the impacts of lead are well known in the medical community. But what we also know is that with a quick detection, many of the impacts of lead could be mitigated, and we're working with our educational partners to establish screening mechanisms through our preschool and child care programs, which will help identify and get these children into treatment quickly. We have great partnerships with the Genesee Health System and the Genesee County Health Department, and we know that with a link to primary care and regular appointments with a physician, children with potential problems, those children will be detected quicker and then get into the services that will help them reach their full potential at an earlier age.
The other thing is we're hoping to supplement that, though, in the broader sense, in terms of more preschool opportunities to make sure that if people have been waiting or on a waiting list for preschool, that there's opportunities for their kids to attend the whole educational process, and then making sure they get the proper training to identify what could be behavioral issues if we didn't otherwise catch them through the medical screening process.
That's correct, and a very important component going forward is nutrition. Diet can certainly mitigate the potential for lead absorption, so a calcium and iron-rich diet is very helpful.